The Sinai Medical Foundation Oral History Project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Howard Nystien, and today's date is June 17, 2024. I am interviewing Dr. Larry Mendelsohn. Dr. Mendelsohn, do you give permission to the Leonard M. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for education purposes or for use as deemed appropriate by the archives?
Absolutely.
Okay. So why don't we just start a little bit at the
Sure.
early part, where you were born, what neighborhood you grew up in,
Okay.
what that was like.
Well, I was born, my birthday is October 29, 1939 in Detroit, Harper Hospital. I lived on the near west side on Taylor till I was about 10. Then moved to northwest Detroit, 1949. From there, lived with my parents until I got married, which was 1966.
Okay. And so what was it like at that time living in Detroit as a community, as a neighborhood?
Well, both of those neighborhoods were excellent. I mean, that's the Detroit everyone's trying to get back to.
Uh-huh. What was excellent about them? What was it like to live there?
Well, it was a city where you could walk, you could take the bus, you could take the streetcar, and there were no fears. Mm-hmm. Even as a 9 or 10-year-old, I was able to take a bus, to downtown Detroit in the morning, on a Saturday morning, because I had a piano lesson down there. Go to a movie by myself around Grand Circus Park, come home at the end of the day, and no one worried about me. Mm-hmm. That changed.
And what schools did you go down to at that time, and
Yeah.
what was it like living in those areas?
Yeah, well, first school was Brady Elementary, and then moved to Pasteur Elementary, and then Mumford High School. And it was, like I said, it was your community, and never thought about leaving it.
And you went to college?
Michigan State.
Michigan State. Okay. And what or who inspired you to go for a career in medicine?
Well, that's sort of interesting. I started Michigan State in pre-dent, and I think it was after my freshman year, I took organic chemistry at Wayne State, and I became friendly with a young man who I think he was graduating U of D. I'm not quite sure, but he was taking the same course. He was already accepted to medical school at Loyola, and we used to study together. And we were studying for the final exam. We took a break, and we just had this conversation. And I asked him that same question: "How'd you know you wanted to be a doctor?" And he said, "Well, I started off from pre-dent." And then he said, and I said, "Yeah, well, how'd you change?" He says, "Well, deep down, I really wanted to be a doctor." And obviously that's sunk in. I said, that's really what I want.
Mm-hmm. What were some of the things that influenced you that way?
My desire for diagnostics, mm-hmm. deductive reasoning, and that's probably how I ended up in internal medicine.
Okay. And so you went to medical school where, and walk me through your medical school, mm-hmm. and then your residency, your internship, your residency.
Mm-hmm. Okay. Went to the University of Louisville, not Louisville, Louisville.
Okay.
And from there, came back to Detroit. I was intern at that time it was called Detroit General, which was Detroit Receiving Hospital, mm-hmm. for the 1 year. Then from there I was at Sinai for 2 years for the internal medicine residency. And then for the third year, I left and did a fellowship at the University of Pittsburgh in endocrinology and metabolism. After that, the United States Army for 2 years, and then finally got into the practice of medicine in 1971.
And the area was endocrinology, did you say?
Well, it's a mixture between internal medicine and endocrinology.
And when did you first hear about Sinai Hospital? Were you ever a patient there? Or did you have a job there?
I really don't know, other than I remember someplace in the early 1950s, I believe, is when it did open. And I don't think I had any relatives that were patients there. I just knew it was there.
So it became just an option for you when you were in medical school, after medical school for residency?
Well, it was an option because I wanted to stay in the area, and my individual local research said that was the best program for me.
Okay. Well, you said you spent some time in Louisville.
That was for school.
Oh, that was for medical school. Okay. But you wanted to come back to the Detroit area?
Yes, always wanted to come back.
And what was it that motivated that?
It was home.
Oh, okay. So your parents were? Is that where you got married, or?
Yes, that's family and friends were more important than, look, I was offered, when I was all finished, I was offered a position in California, but I turned it down.
So your first experience working at Sinai was 66, 68 or so?
As a resident, yes.
And so describe that experience. What was it like?
Good experience, obviously, or I wouldn't have come back and stayed. It was like a family, and that's the best way to describe it. I felt very comfortable. I had just finished a year at Detroit General, where I didn't have that same feeling.
So what were some of the things that were at the hospital that made it feel that way? What was it? What was familiar about it?
Well, the friendliness of everybody. I mean, it wasn't you're the underling and I'm the attending physician type thing. Yeah. Everyone was there to help. They wanted to help to get your education going.
And so once you did your internship at Sinai, did you say you stayed there? Or?
No, it started Detroit General.
Detroit General.
That's the internship, the residency at Sinai.
Okay. And then what happened after that?
That was the fellowship at Pittsburgh.
And then you came back to...
After the armed services.
And then you came back to Sinai?
Yes.
And then walk me through the steps that you were at while you were there. Did you spend your whole career there?
My whole career, right, until they closed.
Okay.
My career hasn't ended yet.
Okay. Oh, that's true. That's true. Through the years that you were there, what changes did you see while you were there?
Yeah, well, I would say their peak was probably in the 1970s. That was the place to be. I don't think there was a better hospital in southeast Michigan. And I don't know exactly when things started to change, but as more patients lived in the suburbs, did not want to come into the city, our competing hospital in Royal Oak was getting bigger and stronger, and the patients were pushing for admission there. That was the transition. Okay,
so it started happening over the 70s or so.
Well, I think later than that. I think all through the 70s we were good, probably till, I'd say, maybe 1983, 84, around there.
And aside from the changes in the population that went there, were you seeing changes in the way medicine was being practiced too during the time you were?
Well, eventually. Again, it's hard to say exactly what year, but if we said 1990, I would say yes, because this was a great staff, and some had left, or at least mixing their time between other establishments.
What about just the systems, the way, what changes in the hospital culture, in the way they practice, that I've been hearing so much about how different Sinai is than, say, Beaumont or Henry Ford and other places, that and now you have hospitalists who are doctors who are just
Right.
and no
Well,
attendings.
it goes back to what I said earlier in our conversation about this being a family. I mean, I was also on the staff of William Beaumont Hospital as of, I think it was 1986, and there was a huge difference between the two. If I needed something done, I didn't have any problem from Sinai. Whoever you called wanted to help and was there in a hurry. At Beaumont, I felt like I had to go through hoops.
Okay. So it was just a more comfortable, more holistic atmosphere. Okay. So I'm just working down some of these things. And what positions did you hold while you were at Sinai?
Well, it's an attending physician, and I was also assistant chief of endocrinology.
Did you teach there as well, or?
Oh yes, I think everybody did.
Okay, well, I don't know if that happens everywhere either. Yeah. And while you were at Sinai, what innovations did you see while you were there?
Well, I'd say that the two main ones one was the development of a coronary care unit. This was hot off the press, and I don't think other hospitals had it yet. And the second is when they started open heart surgery.
Were you directly involved with any of that?
Well, being an internist, unfortunately, many of my patients had heart attacks and were in the coronary care unit, but I was probably secondary where the cardiologist was primary.
I see. Anything else stand out to you while you were there?
That were really top page, I'd say. Those are the two that stand out.
Okay. And so you were there until Sinai closed?
Yes.
So is that 1990?
99, I think, wasn't it?
Yeah, I think it was about then. And how did you feel when you heard about it being closed?
I think I knew it was coming. They were in negotiations for a long time trying to merge with Ford Hospital, and we were always hoping that would happen because it looked like the way the cards were dealt. If you couldn't get this negotiation done and do the merger, it was just going to have to close.
So it was no surprise to you?
It wasn't a surprise.
Okay. And what was the atmosphere at the hospital when some of those discussions, did that affect the mood of people, or?
Yeah, it wasn't outward, but it was a quiet atmosphere, and I think everyone was jockeying for position. What am I going to do next?
Okay. And you had mentioned the family atmosphere at
Yes.
Sinai Hospital. Thinking back, what you liked most about it? I mean, beyond just that general piece, what did you like the most about it?
The quality.
The quality of care?
Yeah, I said we had the best staff in the entire Southeast Michigan.
Were there things that you didn't like while you were there that you can think of that stand out? You were there a long time.
Yeah, well, I could name something.
Okay.
I resented being obligated to go to the Schiffman Clinic and not ever getting a thank you.
Oh, okay. The Schiffman Clinic, that was treating a lot of the Russians that were coming in.
Well, it was before the Russians.
Oh, it was before the Russians.
It was always there.
Okay.
It was mostly indigents.
I see. Okay. So how did that work with?
You were just obligated to put in so many hours. I don't know if it was a year or a month. I forget how it was, but something had to be done.
Okay, so everybody took that responsibility.
Yes.
Yeah. And as you think back, who were some of the people most influential to you while you were there?
Well, probably the most, of course, was Dr. David Jacobs, who was in my first office, and he was about 5 years older and had an established practice. And I appreciated the way he took care of patients, and I learned a lot from that. And I can't say I'm emulating him, but following in the same direction.
Uh-huh. Anyone else come to mind?
No one in particular.
Okay, that's fine. And after Sinai, where did you go from there?
Well, Sinai closed 1999. I was a Sinai employee, and of course they sold to DMC. Was it maybe in '94? I don't know the exact year. So, but Sinai was still open, and so I was really a DMC employee. So, but when Sinai was closed and our contracts were up, they were not going to renew any. So, had to make a decision. Some of my colleagues retired. I was just about burned out then too, going to 2 hospitals 7 days a week, plus having a full-time private practice. But lo and behold, that's when the hospitalist turned on the scene. And I gave that a shot, and then of course it continued to develop.
You were a hospitalist at DMC while it...
Well, there's right. There were hospitalists wherever, as time went on. I was thinking mostly, but you're saying after Sinai, so it really was Beaumont.
Okay.
For me, and so I did not want to retire, so I joined another office, and basically that's what I'm still doing, and using a hospitalist, and that's why I'm still doing it. Otherwise, there's no way I'd be still working today.
And you're a hospitalist where?
Wherever my patients are admitted,
I
a
see.
hospitalist will take care of them.
Okay. So as you think back on your long career at Sinai Hospital, if you could pick just a few things that stand out to you, thinking back that you remember the most, what are they?
I always enjoyed, I don't know why, but even though it was work, it was also social, because like I said, if we were all family, and it was not uncommon, we'll say, after finishing your rounds, to hang out in the doctor's lounge, have a cup of coffee, and it wouldn't be alone. There would always be 4 or 5 people to sit with you and schmooze. And
it sounds very nice.
Yeah.
It's like a family.
Exactly.
Is there anything else that we haven't talked about that you would like to?
I think we pretty much covered it. Yeah.
Right. You were referred here through Eduardo.
Yes.
So do you stay in touch with him?
Oh, yes.
Okay. So I imagine you must stay in connection with some of the doctors that you worked with over the years. Is he must be one of them.
He's one of them.
Are there others?
Others you've probably interviewed. Dr. Robert Michaels, Nissen Sabin.
Okay. I've enjoyed speaking with all of those. Yeah. So if there's nothing else, then I think that we're probably done. I appreciate you taking the time to come in today.
Oh, it's been my pleasure.
Okay. All right.